This one gets a little funky. We're actually going to look at low back function. You need some sort of measurement device. We use this measured pencil you get from like a Crazy Gifts magazine. And you can buy a bunch of them for, a couple bucks. But basically, you need some sort of straight edge ruler, and we're going to measure how much each vertebra in your lower back can flex. The more flexion you have, the healthier things are there. The less flexion, the less healthy. So your low back is approximately 6.5 inches long, each vertebra consisting of about 1.25 inches high. So now we're going to get a little closer and we're going to show you how we evaluate this test. What we're going to do here, first thing is we got to find some anatomical markers. So those crest of your hips, those big bones right in here, we're going to find the top of both of them. So there's like a little area. We're going to find where that bone is. That's your SI joint. That's the start of that PSIS, posterior superior iliac spine. Right there, between those, we like to use a little marker so we know where we're at, but right between there is the base of the spine. So you can put the end of your ruler or your pencil right there. Now, what we're going to do is so there's our mark. We're using a little grease pen, figure this out. Now, what the person being tested is going to do is going to squeeze their butt and arch their back, kind of like if you're in yoga, cat-cow. You're going to squeeze really hard and arch up best you can. As you see, the spine does some nice flexing there. And this is what we're going to do. You can kind of see a nice little teeter-totter. We're going to over each 1.25 inches. So this first one should have a nice little range of motion there, and as you can see, it goes off the end there. So we could say that would be a value of 2, as in it's got full flexion. If it's flat and it doesn't move at all, it gets a value of 1. If it doesn't move at all, it's a value of 0. And you just basically add those numbers up, multiply by 10, and that's the percent function you have. So with this spine, we're looking here, and you can see that she's got maybe a 1 here at the bottom. Then we got another 1. And then we got a nice little teeter-totter here at L3 in the middle. So 1, 1, 2, 2, 2. So we have nice range of motion, these top 3, and half as much as we should have down there. Multiply 7 by 10, that's 70% function. A flat spot longer than 1.25 inches indicates something is flat. So that is how you evaluate a low back function.